Hello to all who are watching, and I send my warm greetings from my house overlooking the sea in Dublin, Ireland. My name is Bill Emmott, and in normal times I would have been doing two things in these months. First, I would have been dividing my time between Ireland, the UK, and Italy, both for personal and professional purposes. And second, I would have been preparing to fly to Tokyo to give a public lecture at Tokyo College on June the 12th in my capacity as an Ushioda Fellow. As these times are very abnormal, I have been unable to do any of those things. But I'm delighted now to be giving this video talk for Tokyo College about the COVID-19 pandemic and its repercussions in the two countries I live in, Ireland and the UK, and the country I spend a lot of time studying, Italy. In fact, I think a comparison between the experiences in these three European countries can be quite instructive. In describing the way the pandemic has affected the UK, Ireland, and Italy, I will divide the analysis into three parts. 1, the health impact. 2, the political impact. And 3, the economic impact. These, of course, overlap in many ways, but in my view, they need to be distinguished in particular because they cover different time periods. The health impact is immediate and contemporary. The political impact is also immediate, since politics never goes to sleep, but in truth it is likely to evolve over time. And the economic impact is largely in the future, whatever statisticians may say now, and it depends on both health and politics, but also on international factors. I'll begin with the health impact, which has been very severe in all three countries, far more so than in any country in Asia, certainly more than Japan. But I will insert a socio-political observation, which is more positive. This is that in all three countries, society has responded to the health crisis in a remarkably cohesive, trusting, and responsible way. Theories that claimed that in the West, social trust and cohesion were declining have been considerably rebutted by the experience of the UK, Italy, and Ireland, and in fact of all European countries. So far, our societies have proved reassuringly strong and cohesive. In Italy, the COVID-19 virus arrived earlier than in the other two countries. A cluster of contagion was detected in an area of northern Italy east of Milan in mid-February. A quarantined red zone, a zona rossa, of that area of the region of Lombardy was imposed on February the 21st. I made my most recent visit to Italy on February the 26th, visiting Rome to meet politicians and scholars. And although precautions were already being taken in the country's capital, it is fair to say that most people I met did not consider the crisis to be a serious one at that stage. It was one happening in the north of Italy, hundreds of miles away, not in the capital, Rome. But they and I were wrong. A national quarantine with strict laws enforcing stay-at-home orders and business closures was duly imposed on March the 9th, as the casualty rate rose rapidly, chiefly in the Lombardy region around Milan, but spreading across the country. This is one of Italy's and Europe's wealthiest regions, but even there, the health system quickly became overstretched in a dangerous way. What Italy's experience did mean was that other European countries, including the UK and Ireland, had the chance to observe what was happening in Italy, and therefore to take decisive and rapid action to avert or at least reduce a similar crisis occurring in their own countries. But this didn't happen. Other governments appear to have believed that there must be special Italian reasons for why their suffering was so great, and that things would be different in Britain or in Ireland. Ireland did force bars to close from March the 15th because of fears of rapid contagion happening on the national holiday, St. Patrick's Day, on March the 17th. But a major horse racing event, the Cheltenham Festival, was still allowed to take place in Britain on March the 16th to the 19th, which was attended by tens of thousands of people from both Ireland and the UK, given that it's a very popular festival for Irish people as well as the British, most likely allowing the virus to spread in both countries. The UK government insisted at first that it could contain the spread of the virus without imposing draconian restrictions on social activity. Ireland was not so confident, hence its closure of pubs. But on March the 23rd, the UK began finally to impose stay-at-home orders and to close businesses, and Ireland announced its own, even tougher restrictions on March the 27th. The reason to list these dates in detail is simply to show that it took time before politicians and officials felt able or willing to take drastic actions to control the virus. At this time, the mortality rate in Italy was rising dramatically, yet both the UK and Ireland took time to learn from this. Timing is not, however, the only important factor. If we look at the official mortality rates from COVID-19 for the three countries as of May 21st, we see very similar rates for both Italy and the UK. Each has reported COVID-19 deaths amounting to around 535 people per 1 million population. That's 32,000 deaths as of May the 21st. In Italy's case, 36,000 deaths in the UK's case. Ireland, by contrast, had, as of that date, reported just 1,571 deaths, which amounts to a rather lower proportion of 320 per 1 million population. Admittedly, comparisons are made hard by the fact that official COVID-19 mortality data is reported in different ways in different countries. The true impact of the virus will be seen only once overall excess mortality can be calculated. Britain's Office for National Statistics has already released data on the level of mortality compared with the average of the past 5 years, which sadly indicates that the true death rate in Britain is a great deal higher than the daily reported rate. Calculations by the Financial Times, which seeks to project forward the Office for National Statistics data in order to achieve a more up-to-date picture, suggest that as of May the 21st, the UK's full mortality figure for the COVID-19 period may be approximately 60,000, compared with the official figure of 35,000. Italy's data for excess deaths for the period up until April the 30th were released on May the 20th. They indicate that in the period from March the 1st until April the 30th, the total of excess deaths compared with expectations based on previous annual averages was similarly about 20,000 deaths higher than the official numbers. The excess deaths data for Ireland are not yet available. They can only be estimated at present by comparing official death reports with the notices of death that people publish in newspapers, which remains a strong Irish tradition. These two indicate that the overall impact has been higher than the direct official figure, though probably by a smaller margin than in the UK and Italy. The exact statistics and how they should be attributed between deaths caused directly by COVID-19 and those associated indirectly with it will not be known for a long time. But what the data tells us is two main things. First, of course, that the mortality impact in both the UK and Italy has been very severe indeed. Second, that the health systems of both those two countries were unable to cope with the volume of patients, leading to quite large numbers dying at home or in elderly care facilities rather than in hospital. Some of those who died outside the hospital system may not have suffered the COVID-19 virus, but may have died because the virus's impact was such that they were unable to get the treatment they needed. The problem was not simply or even mainly that COVID-19 patients hit the hospital system's capacity limit for intensive care treatment. It was that resources of all kinds had to be diverted away from conventional healthcare into COVID-19 emergency care, which led to people being refused admission to hospitals and then dying elsewhere. Our health systems were not sufficiently resilient, but also not sufficiently flexible and responsive amid a situation that was unprecedented and that involved a virus the treatment for which was largely unknown or untested. The UK and Italy have been two of the most severely hit countries in Europe. But Ireland fared somewhat better, even though it too has suffered. It is hard to be sure about why this is, but one factor is that its hospital system was never overwhelmed in the same way as were those in parts of Britain and Italy. A second factor, which may explain this, is that Ireland moved more rapidly and effectively than Britain to introduce large-scale testing for the virus. This was also true of some regions of Italy, but Lombardy, the worst hit, was slower to introduce testing than some others. This failure to introduce widespread testing at an early stage seems to have hampered efforts to track and control the spread of the disease. A final word on health. This coronavirus turns out to have been quite severe, this coronavirus turns out to have quite severe and lasting effects on some patients who nevertheless survive. Those countries, like Britain and Italy, which have had high numbers of cases, will also therefore now have quite a large number of patients who will suffer long-term health problems resulting from the virus and will require continuing treatment. So while for sure we will be dealing with subsequent waves of infection for as long as this virus continues to survive and for as long as we don't have vaccines against it, there will also be some long-term consequences for the quality of health for some people who have survived the virus but have been nevertheless badly affected by it. In the second part of this talk, I will move on to the political reaction and potential longer-term political consequences. One thing I find interesting about the pandemic all over the world is that the political reaction, at least as measured by public opinion and the volume of media criticism of government, has not been directly related to the health outcome. In other words, good health outcomes have not protected governments from criticism, and nor have bad outcomes necessitated severe criticism. As you know, Japan has suffered very low mortality by international standards, and its health system has not been overwhelmed. And yet, public support for the Abe administration has declined. In Italy, by contrast, great suffering and a terrible health outcome have nevertheless resulted in quite strong public support for the incumbent government and its Prime Minister, Giuseppe Conte. This is partly because a main focus for criticism has been the governor of the worst hit region, Lombardy, and that governor comes from the main opposition party, the Lega, so this has made it hard for the opposition to attack Prime Minister Conte. But let's compare it with Britain. In Britain, initially the government of Boris Johnson gained quite strong support. This rose further when Prime Minister Johnson was himself hospitalized, suffering from COVID-19, and was indeed pretty seriously ill. But since he has left hospital and returned to work, his approval ratings have actually declined rather sharply, even falling below those of the main opposition leader, Sir Keir Starmer. Ireland stands in the middle. It has had a caretaker government throughout the health crisis, as negotiations to form a new government following elections on February the 8th are still continuing. Nevertheless, the caretaker Prime Minister, who is himself a medical doctor, Leo Varadkar, has received solid support in the opinion polls. How to interpret this difference of circumstance and of reaction? My sense is that in all countries, the COVID-19 pandemic is considered by the public to be an event for which no government can really be blamed. It is similar in that sense to a natural disaster, except one that's continuing over a period of time. What governments can be assessed and blamed or praised for is how they react to the disaster, how decisively they are seen to act, and how consistent and clear is their communication. In this health crisis, I think communication has been the most important of all, for it directly affects society and social confidence. The distinction between Britain, Italy, and Ireland on these measures is clear. In Italy and Ireland, governments have been praised and supported for their strong and consistent communication, amid a general sense that national unity needs to be preserved. Britain's government, however, has lost some confidence in the public and the media because its decision-making and communication has been quite inconsistent. It has made promises about treatment, about testing, and about containment of the virus that have quite quickly been found to be false or exaggerated, and that sometimes have been rather swiftly abandoned. So, for the time being, the British government is not doing well in terms of public trust and confidence, while those of Ireland and Italy are doing better. But these are early days, because the crucial issue in the longer term is going to be the economy. This is what will ultimately determine the political consequences of this pandemic in all three countries, as in the rest of the world. So I'll move to the third part of this video talk, the economy. In early May, Italy began relaxing some of its social restrictions as its number of cases and deaths had declined very sharply. On May the 18th, it permitted a wide range of businesses to reopen. In the UK and Ireland, the relaxation and reopening has been slower because these countries' health crises have also happened later than that in Italy. In all three countries, however, with cases and deaths declining, the reopening is planned to happen in a series of phases between now and August. The response of all three governments to the economic impact was initially very similar. Like all governments around the world, those in the UK, Italy, and Ireland made available pretty generous subsidies to individuals and to businesses so as to give them short-term support, to keep them alive, as it were, while the economy was sleeping. The economic effect has naturally also been very similar. In the March to June period, all three countries will suffer an unprecedented reduction in GDP, which will look pretty dramatic. But while this is shocking, it is not as important actually as the longer-term economic effects. What will those longer-term economic effects be? The answer, to be honest, is that we don't yet know. And a big reason why we don't yet know is that they depend crucially on when an effective vaccine becomes available, because that will have the biggest effect of all on economic activity and on the return of demand and corporate investment. Having been very slow in reacting to the health crisis, the British government of Boris Johnson is hoping that the UK will be the first, or one of the first, countries to develop and mass produce a successful vaccine, thanks to collaboration between pioneering work at Oxford University and ambitious investment by the AstraZeneca pharmaceutical firm, which has its headquarters in the UK. If the human trials for this vaccine prove successful, this could remarkably be available as soon as September, October this year, even in millions and millions of doses. It would be wrong, of course, to depend upon this benign and remarkably rapid outcome. But if for a moment we can be allowed to dream, and if my faith in my alma mater of Oxford University proves well-founded, then our economies would in that case be able to expect quite a rapid recovery as both employment and demand return with great force. This leaves, even so, some important distinctions between the three countries under consideration, even in that benign scenario, distinctions that will become larger if the scenario is not so favorable. If it is an unfavorable scenario with no vaccine, let's say until 2021, sometime in 2021, then recovery will be slower and the long-term damage to output, to skills, to investment, to economic trust and activity will be much deeper in all our countries, ending up, I think, worse than the 2008 global financial crisis. For the moment, it's too soon to judge whether the overall outcome will be better or worse than 2008, even though statistically we already have bigger declines in GDP. It really all depends on the speed of the recovery. The distinction between the three countries will, in either case, as I've said, be important. Italy, in particular, entered this crisis in a more vulnerable economic condition. Neither its per capita GDP nor its average household income has yet managed to rise back above their levels in 2007, before the global financial crisis. Its public debt has been 120 to 130% of GDP ever since the early 1990s. So its public finances are less well able to support its economy, to rebuild its health service. Italy will be much more dependent on collective EU-wide recovery efforts than will Ireland, and of course, Britain is a different case altogether since it's leaving the EU. The UK and Ireland both entered this crisis in better economic shape. In the UK, however, as I've indicated, there is the complication of Brexit. In 2020, the UK is supposed to be negotiating its long-term trade, investment, and security relationship with the European Union, after which we will also conclude free trade agreements with other countries, notably the US and Japan. We left the EU in formal legal terms on January the 31st, 2020, but with a transition period of 11 months, still under EU market rules and customs arrangements until December the 31st, 2020. The negotiation currently is not proceeding very smoothly, and there is a real danger that we may fail to reach agreement. I hope this worry will not come true, but if it does, then it will hurt the UK economy as trade barriers will rise between us and our main market, the EU. Adding together a Brexit-related trade disruption to the pandemic would produce a pretty bad outcome in the British economy. Most of all, it is the economic phase of this pandemic crisis that will have the most long-lasting effects on politics. Social and political reactions will be strongly critical if our countries suffer long recessions, if taxes rise sharply, and if welfare supports are removed or reduced in an inequitable way. The critical periods are likely to be the second half of 2020 and the whole of 2021. In other words, the political consequences of this crisis are still in the future. I feel generally optimistic about this, but it is important to recognize the risks. If a vaccine can be developed and widely distributed quickly, thanks to a remarkable global period of intensive scientific effort and collaboration, then I believe the long-term impact of the pandemic will not necessarily be transformational. We will suffer from the economic losses, from bankrupt companies and highly indebted public finances, but mainly in that case, what we would see is an acceleration, mildly, of trends that were already in place before the pandemic. Digitalization, declining retail sectors, some protectionism, populist politics, the decline of American leadership in the world. But if the health and economic crises prove much longer lasting, enduring not just to the end of this year, but also through 2021 and beyond, I then believe the impact may well be more transformational and dramatic, and not necessarily in good ways. The economic destruction that this would impose on all of the UK, Ireland, and Italy would have profound political and social consequences. I could put it in another way. In the event that the Tokyo Olympics has to be cancelled in 2021 because the COVID-19 pandemic crisis has not been solved and contained, then this will not just damage Japan, it will spell very severe economic and political trouble for European countries too. Thank you for listening, and I look forward very much to the roundtable discussion that we will have shortly.